a Rotary Global Grant for suicide risk screening and mental health awareness in Indigenous youth, a global grant implementation trip. This project partnered with the Guatemalan nonprofit Ak Tenamit, which means New Village in Quechua, a Mayan language spoken in Guatemala. Ak Tenamit, supported by the U.S. 501c3 nonprofit, the Guatemalan Tomorrow Fund, believes that sustainable change must be indigenous-led. The project thus integrated Guatemalan local knowledge and Rotarians with outstanding experience in effective mental health strategies. The project began with a January 2025 pilot study and needs assessment that proved that culturally sensitive screening frameworks improve access to mental health services and reduce stigma in vulnerable communities. The pilot showed that structural factors, including poverty, stigma, limited service availability, and institutional mistrust were amplifiers of suicide vulnerability.
Youth around the world are increased needs for mental health, increased mental health supports. What we're doing here is providing a mental health tool that's going to help screen, detect suicide, and lead to the right health services. What's beautiful about this project is that through individual screening and stigma reduction, we're helping the community heal. The community heal with the assistance of technology, bringing technology to the community with innovation and cultural integration, and that way be able to provide screening, mental health supports and systems, but also detect risk early on to be able to direct to the health authorities and work with the general school community in this process.
The Rotary Club of Howard West partnered with Tecalpatan Rotary with support from Maryland Rotarians.
Hola, un saludo a todos en nombre del Club Rotario Tecalpatan, súper agradecidos con Guetta, con todos los socios que han apoyado este gran proyecto. Sin salud mental no hay salud.
No hay salud, mira, saludos señores.
I've worked on Rotary-driven mental health projects all over the world. What makes this one remarkable is that we have a cohesive, well-rounded, extremely efficient, bilingual team that understands the problems of the Guatemalan school community. The other issue I want to tell you is that we've been working on this for over a year, and I've had time to bond with local Rotarians who offered support in Maryland, and I bet you we'll do a bang-up job of executing this project.
The May 2026 project carried out a workshop with teachers, psychologists, and counselors. Our screening process first explained the importance of understanding and expressing emotions. Instructors used the culturally relevant analogy of taking care of personal mental health, comparing it to taking care of a corn plot, known as a milpa in Guatemala. Students saw that taking care of one's mental health with care and dedication is similar to the careful care of a corn plot. The second part of the process was the actual implementation of a 60-question online risk assessment that in turn could lead to further evaluation. We shared the toolkit in both Spanish and Quechua in a Teach the Teachers session so the teachers can carry on the work of helping their students. Over 3 days, our team interviewed 269 students, had follow-up interviews with 16 students, and arranged treatment for 9 high-risk students.
I was selected by Rotary to be recognized as an agent of change at the Singapore Convention, and there I had the opportunity of meeting with Dr. Gita and learning about her incredible work in India, in Kenya, and other places, working with training local indigenous leaders to be lay mental health providers and to help identify cases of youth that are at risk of suicide and depression and other risky behavior. And so based on that, we were able to develop this global grant proposal with the local Tikal Rotary Club and we're really excited to be able to start implementing this global grant, which will be scalable, it will be sustainable, and long term it will have a tremendous impact on the lives of the rural indigenous youth that we serve.
Yes, this global grant mental health pilot project resulted from two Rotarians meeting at an international convention and with the support of the Rotary Action Group on Mental Health Initiatives. Rotary is increasingly focused on mental health, with the support of leaders like President Gordon McInally and his Don't Bottle It Up campaign. These students face the significant challenges associated with poverty, and yet with the help of Ak Tenamit, our team saw an optimism and confidence that made it clear these students believed in themselves and in their community. Our team firmly believes that integrating intercultural assessment frameworks into school and primary care systems may promote timely, culturally safe, and community-grounded suicide prevention strategies in resource-limited indigenous contexts. We hope to work with Guatemalan health and education authorities to take this project forward.
Jay, is it true you're the spiritual leader of this project?
Yes.
Yes.
And
Well, or the comic relief, or both.
no, it is both, but it's a
Both.
relief.
Ah, thank you.
That is
Thank
the
you.
most important.
Thank you, Jay. We love you, buddy.